One of the questions I'm asked most often is, when will this pandemic end? My answer is that one of the questions I'm asked most often is, when will this pandemic end? My answer is that the pandemic will end when the world chooses to end it. It is in our hands. We have all the tools we need: effective public health tools and effective medical tools. But the world has not used those tools well. With almost 50,000 deaths a week, the pandemic is far from over. And that's just the reported deaths. As you know, we have set a target to vaccinate 40% of the population of every country by the end of this year. That target is reachable, but only if the countries and companies that control supply match their statements with actions. Of course, recently, as Jens said, there are recently encouraging signals of dose sharing, and we thank Germany for its generosity, but as he had said, we need more. And there are few things that I would like to propose, few things we need to do. The countries that have already reached the 40% target, including all G20 countries, must give their place in their vaccine delivery queue to COVAX and the African Vaccines Acquisition Trust, or AVAT. The G20 countries must fulfill their dose sharing commitments immediately. Manufacturers must prioritize and fulfill their contracts with COVAX and AVAT as a matter of urgency, and be far more transparent about what's going where. And they must share know-how, technology and licenses, and also including waiver of intellectual property rights. If we do this, we can end the pandemic and speed up the global recovery. The second major question the pandemic is asking us is, how will we prevent this happening again? How do we make the world safer? In its first report in 2019, the Global Preparedness Monitoring Board warned that the world was unprepared for a pandemic just months before COVID-19 struck. We welcome the GPMB's latest report, which will be launched on Tuesday here during the World Health Summit, and its recommendations, as he is with us, and I'm glad that he is in person here, the chair of the GPMB, to present the report. And allow me to offer 4 answers, 4 areas in which the global health architecture must be strengthened. First, governance. For the past 20 years, the response to every crisis or health threat has been to create a new institution or mechanism with new governance structures and new funding needs. The result is a global health architecture that's complex and fragmented. That's why we believe the time has come for a legally binding international agreement or treaty on pandemic preparedness and response, which will be the focus of next month's special session of the World Health Assembly. Second, financing. Cycles of panic and neglect have created a financing ecosystem that is insufficient, inefficient, and inequitable. It's clear that we need a substantial increase in funding for national and global preparedness and response. Crucially, Any new financing facilities must be built using existing financial institutions like the World Bank, the IMF, rather than creating new ones that further fragment the global health architecture. More broadly, it's clear that we need a new narrative for the way health is financed, which is why earlier this year we established the Council on the Economics of Health for All, led by Professor Mariana Mazzucato, and third, systems and tools. COVID-19 has exposed serious gaps in the global ability to prepare for, prevent, detect, and respond rapidly to outbreaks with epidemic and pandemic potential. We need new tools across the One Health spectrum. WHO has already taken steps to build some of those tools, including the new hub for epidemic and pandemic intelligence here in Berlin.